Thank you, Governor, Lieutenant Governor. Thank you to the town of Plymouth and to the Plymouth County Mosquito Control District for hosting us today and for all of the great work you're doing on this virus. I'm pleased to join you all in Plymouth today to talk about the important work that is being done to prepare for and mitigate the threat to public health presented by mosquito-borne illnesses like Eastern equine encephalitis and West Nile virus. Last year's mosquito season resulted in EEE cases and several tragic deaths throughout the Commonwealth, as the Governor noted. Over the past 9 months, Massachusetts has been taking important steps to prepare for another outbreak of EEE through our work with the State Reclamation and Mosquito Control Board and our work with mosquito control districts and projects throughout the Commonwealth. The administration has focused not just on preparing to respond to heightened public health risk from EEE, but also to improve upon our mitigation tools for proactively reducing mosquito populations that spread the disease. This spring, we started early, even in the midst of the COVID-19 surge. Larviciding applications were conducted by regional mosquito control districts targeting almost 20,000 acres in 110 member communities for treatment in 10 counties from the Berkshires to Cape Cod. These larviciding operations targeted the specific mosquito species that drive the EEE disease cycle. These operations were performed using helicopters or a fixed-wing aircraft for aerial applications and by hand using backpack sprayers throughout April and May. And it's really important to get this done during the early season so we can target the larvae of mosquitoes. Regional mosquito control districts have also coordinated to conduct field trials using 3 different larviciding products to study the effectiveness of early spring treatments. This research will help to expand available tools to reduce the risk of mosquito-borne illness transmission, and we look forward to the results of these important studies. Additionally, we have implemented an accelerated schedule for mosquito collections submitted for virus testing for 2020 with DPH to get testing results earlier in the year throughout the season and earlier in the week. The data we collect on mosquito populations through mosquito testing for EEE and West Nile virus and the determination of risk levels will drive our decision-making for the appropriate mosquito control interventions. This important work is happening now. Truck-mounted spraying, such as the equipment you're seeing here, using adulticiding products started in early June and continues now. These operations will run through the end of August into the first week of September while we continue to monitor the mosquito testing data from the Department of Public Health, and Commissioner Burrell will speak more to that. One of the tools we need to expand this type of proactive work, as the Governor mentioned, across the state and not just within mosquito control districts, is the EEE legislation that the Governor filed in April. This legislation would allow essential preventative activities, such as spring larviciding, to be conducted in areas that were EEE hotspots last year that may again be at high or critical risk, but may not be part of a mosquito control district. The goal of this legislation is to allow enough proactive work early in the season targeting these hotspots in order to actually prevent broader aerial spraying later in the season that we had to resort to last year. We thank the legislature for their collaboration through and look forward to the passage of this legislation and urge quick work on this so we can start to get these efforts out across the state. I also do need to remind horse owners across the state to vaccinate their horses against EEE. Horse owners should be aware that EEE is spread by mosquitoes and causes fatal neurologic diseases in horses, and we're lucky to have a vaccine available for horses. Last year, EEE led to the death of 8 horses in Massachusetts. As I said, there's an effective vaccine for horses. There is not, unfortunately, a treatment or vaccine available for humans. EEE, as the Governor said, is a very serious disease that can affect people of all ages in every region across Massachusetts. I think as we continue on our proactive work early in the summer and continuing to monitor the data, it's important that we all remain personally vigilant against the risk of the mosquito-borne illness as well. Spraying for mosquitoes does not eliminate the risk of EEE transmission, and we ask the public to continue to follow personal protection practices that Commissioner Burrell will detail in a moment. I'd like to thank the Department of Public Health, the State Reclamation Mosquito Control Board, the Department of Agricultural Resources, and the mosquito control districts across the Commonwealth for their partnership in tackling this significant challenge and for their work under more difficult conditions this spring. We look forward to even stronger collaboration as we enter the peak mosquito season. Now I'm pleased to introduce Dr. Monica Burrell.